Come on. Alright, just have a seat, please. Okay. Sorry, we're running a little bit behind. Two of my nurses, unfortunately, are not here, and I've been having to do everything myself. Just shows me I kind of take them for granted, I think, a little bit. But anyway, do you have the paperwork with you? You do. Okay. Okay. And you have signed and initialed each page? Alright, that's wonderful. Okay. So I'm just going to do your intake. Alright. In fact, what did I do with that? If I look at your notes, it should give me your hospital number. Okay. System can't find you. Are you a new patient? Okay, a second. No, it's not finding you. Can you give me your date of birth? Alright. And your full name. Have you just get married? Right. No, okay, so were you known by any other names previously? Okay. Why is this not finding you? This is the last thing I need right now. Okay, I'm just going to need to do a new intake. Okay, can I get your full name, please? Alright. And type up these basics, and then I'll get one of the nurses to sort it out later and see if we can actually find you on the system, because the very fact that we've got your forms here means that you have already been put on this system, but there's something, there must be a glitch or something, but we will find you, don't worry about that. Okay. And your address. Okay. And do you have somebody with you to get you home after the operation? Okay. And you're not taking public transport? That's good. Okay, I wouldn't have went ahead with that, no. You will be quite drowsy and in a lot of pain, so that wouldn't be acceptable. Okay. So what's your next of kin's phone number? Both the landline and the mobile number, please. Okay. That's fine. Oh wait, I think, is this you here? What was your address again? Sorry. Alright, okay, I found you. I wonder why that wasn't showing up a minute ago. See, I'm not used to doing this. Okay, so I've got you there. Alright. And you've paid in full. Okay. That's fine. Okay. So you understand what this procedure entails. Okay, so we've already grown the donor in the lab, so it should be downstairs ready for once we are ready to begin. So we'll be taking your own skin and we'll be applying a corrosive material to the face, which would burn off the first 2 layers of your skin. Once we've scraped that away and cleaned your face up, we will then prep the skin and apply the donor to your face to the exact specifications in which we have grown this for you. Now, the recovery period can differ from a few days to a few weeks depending on how you take the graft. So it's different for everyone. We've had some patients who have recovered within 3 days, and we've had some patients who a month and a half later are still recovering. They are still in pain. Worst case scenario is rejection, obviously, but since we've opened this clinic, we haven't had a case, because usually it's me doing the operation and my hands are just wonderful. Therefore, you are in good hands, as you know. That's why you requested me to be your surgeon. Now, if there is a rejection, obviously, we will put you into a coma state while we grow another graft for your face. We will then run bloods to figure out why you rejected the initial. So you don't need to worry. Regardless of what happens, you will end up with a face of your choosing. It might just take a little longer to get there, but it is doable. Yeah, no, I haven't had one fail since I started here. So you have already organised everything, and the face should be downstairs and ready to go. It's fully viable for 24 hours. So if you get a little bit of cold feet, we can wait a little while. However, I wouldn't put it off too long, because I have full books and I can't wait. We have other patients to see. So I will give you a short wee while if you are beginning to get anxious about the procedure, but I can't wait too long. The procedure in itself is quite easy. The surgery shouldn't take too long, but you will be put to sleep while the procedure is going on, so you don't need to worry about being awake during that. Yes, the only pieces that we leave, obviously, is your eyelids. There will be seamless where it connects to your face. We will be using a microscopic laser, which will work through the graft and attach those together. A small bovie. So we will be using that. And you're wearing makeup. No, that's no problem. I can take that off before, obviously, before you're going down for surgery. Okay, I'm going to be checking your face in every minute because I want to make sure there's no contraindications. There shouldn't be after your analysis yesterday. Yeah, so I just want to go over and just make sure that everything is fine. I have to, for my own insurance purposes, I have to make you aware exactly what it can entail, so that you're going into this with your eyes wide open, so to speak. Okay, so as I said, that the waiting time for recovery can be anywhere from a few days to a few weeks. There will be swelling. You may get some pus and some crusting. It's not going to be fun. It's not pleasant. Me? No, I haven't had it done. Well, I can't have it done because the only person I would ever trust to do my own face transplant would be myself, and I can't operate on myself. Therefore, I am left with this face, but it doesn't bother me. I'm quite happy with the face that I have. Hair. We do the hair as well. We can do a hair transplant. This is the first time you've mentioned it to me, so I wasn't sure that you were interested in that. Had I known that you would have been interested in a hair transplant as well, we could have done the both at the same time. But there's no point worrying about that now. I can put you in touch with my colleague because he is actually one of the best at doing that. My forte is faces. So he is one of the best surgeons for doing a hair transplant, so I will give you his name, and you can make an appointment to see him. But I would advise at least a few months letting your face recover fully first before going to see him. Okay. Alright, so what I'm going to do now is I'm going to get this here. It has a little light, and I'm going to be shining it into your face here, because I want to make sure that there is nothing. Yes, I forgot your makeup, it's got to come off first. So I will be doing that, then I will be examining all of your pores and making sure that everything is ready for me to work on. Yes, that should be fine. I've got something here, so it's just normal mascara you got on there, so no. Okay, that's fine. So waterproof can be a little bit of a pain to get off, but if it's just normal, it should be a lot easier. Okay. Alright, so if you could just close your eyes for me, please. Okay, and I will just be wiping off any right. Okay. Okay. Yes, it's been a little bit of an experience working without my nurses, but I think I'm surviving. But I will be very happy when they're back. Yes, the nurses usually take the makeup off my clients as well. Yes, I usually do see a lot of patients here. I do get some defects, but mostly it's people wanting to get into the music scene, or they want to model, or they're just not happy with their own face. And they have an ideal in their head of what they think they should look like, and that's why they come here as yourself, because you see what you want to. So you create a version in the lab using the golden ratio and build to your specifications. And so I do make a very decent living out of this. I don't think I would do anything else. I used to do hands. In the elderly community, there was a lot of people that wanted their hands done, so I would do a lot of work there, because hands are one of the first signs of aging. So I did have a lot of patients who requested hands, but then I moved on to the face and I wouldn't look back. Okay, I'm going to put some lotion on your face, which will open your pores so that I can see if there's anything. Most issues, yeah, with the acid, that's correct. Most issues will be burned away with that, but I'm just looking to see if there's anything on a deeper level that would cause an issue. So I'm going to sanitize my hands, and then I'm going to have a closer look at your face. Okay. Right. Right. So I'm going to start on the outer layer and I will work my way in with a stronger magnification. Alright. Now, I'm just going to examine your forehead. You have a bit of dry skin on your eyebrows. Have you been moisturising it like I asked? Okay. It's not going to be an issue when it's burnt off. It's what's underneath that could be the problem when we attach the graft. I guess we'll see when the top layer comes off if there's anything on the underneath that could be a bit of a problem. Okay. You have quite thin skin on the underneath of your eyes, but that will be fine. I'm sure that I noted that before. Yes, that has been grown thicker for you as specified. Okay. Right. Your cheeks there. Okay. I am seeing a couple of spots that look like they have some deep canals into your face, but again, I can deal with that. I can surgically remove any issues if it goes quite deep. That's fine. Alright, and over here. Okay. Your ears. Again, yes, you seem to be a perfect candidate for the procedure. I'm just going to move up now. I'm going to use a number 3 just to check. A little closer. Okay. Right. And okay. Okay. Right. Right, I'm going to use the number 5 and I'm going to go in with a chill amount. I'll just get first set here. I just want to have a little pick at this. I just want to see how deep this goes. Okay, because there seems to be some dry area just underneath your nose here. Okay, I'm seeing a little bit of a problem. It should be fine. I'm just going to have a little take and see how that is. This won't hurt. Okay. Okay, so what I need you to do is I need you to take a deep breath, okay? Okay. That's right. Okay. Okay. So actually that doesn't seem to be as big a problem as what I thought. So it looks like we can actually go right ahead with the treatment. Alright. Now I'm going to give you a couple of painkillers because once the treatment starts it will be a little bit painful, but these will take the edge off and make you feel a little bit drowsy. So I'm sure I have some here in my cabinet. Here we go. Okay, hand. Okay. Now hold on. There should be a cup of water there beside you. Alright. You just swallow them over. Right. Okay, have you taken them? Alright, they work usually quite quickly. So I'll check your skin before I actually apply anything because I don't want to apply the acid if the medication isn't kicked in yet. So I will just clear this stuff away just now. I don't need this because I will be using the apparatus I have down in surgery, so I can just put this away. Alright. That's the thing, when I take these out I can never figure out how to put them back in. There we go. That's fine. Okay, so I'm just going to check that there is a theatre available. Okay. And I will just set a call downstairs to let them know that we will be heading down, so they have to send up a porter to take you downstairs in about 15 minutes. Alright, okay. So I'm going to pinch your face and I want to see if you can feel it. Okay. Can you feel this? You feel this? What about this? Okay. So your skin seems to be numbing up quite nicely. So it doesn't tingle or anything anymore. Alright. Okay, so I'm going to just put on some gloves because I do not want to touch this acid myself. I can okay. Just got to be very careful when I open this. Are you ready to start this treatment? Right, that was downstairs letting us know that they are ready. Okay, so as if the buzz again, it will then be telling us that the porter's on the way up. Okay, so I better get started now with this treatment. Okay, so I want you to tilt your head back and close your eyes. Okay, when I touch it to your face, try not to breathe because I don't want you to inhale those noxious fumes. I will tell you when you can breathe. Okay, so close your eyes, and I'm doing it now. Okay, hold your breath and breathe. Alright, I thought for a second there that was that acid. Thankfully it was just my glasses. Okay, so I want you to again take a deep breath. Ready? And is it causing any pain? No. Okay. Just get some more. Okay, and again, take a deep breath in. Just add that down here on your cheeks. Okay. Any discomfort? Okay. So, and breathe in. And breathe out. And now around your chin. And this is slow acting. It'll take a few minutes before it starts to get in. Okay. The bridge of your nose. Yes, we want to cover everything, so breathe out. Alright, and I'm going to try and smother, so take a big deep breath. Okay, ready? And breathe out. Okay. And out. Okay. Then you start to feel it. Feels weird. Okay, I think that is your covered. Starting to give your skin a green tint. So I can see. That's fine. So the only areas that we didn't want covered was around your eyelids, and that seems fine. Okay. I haven't heard a buzz, but I think that the porter should be up. And now, at the reception, of course, there's no nurse to greet him, so I'm going to need to go out and we'll get him to come in. So you just sit here and your skin should start to tingle, and we'll get the porter to come in and we'll wheel you down to surgery so that we can get that scraped off and get your new donor face put on. So I will see you downstairs. I better go and get scrubbed and ready for doing the operation. So I will see you when we get downstairs, and well, obviously you'll be unconscious by that point, so actually the next time I'm going to see you will actually be when you're in recovery. I'll come down there and see you before you're signed out. Okay? So you just take some deep breaths and I will go and get the porter.